The Infertility Clinic through the Department of Obstetrics and Gynecology at Queen's University brings you the facts about fertility. More and more Canadian women are waiting longer to start a family due to longer periods of education, participation in the workforce, and later marriages, and as a result, the number of couples with infertility is increasing. The definition of infertility is lack of pregnancy after 1 year of unprotected intercourse. Because fertility declines with age, it is appropriate to begin investigations and treatment in women aged 35 and older after only 6 months of trying to conceive. Infertility is common. In Canada, more than 10% of couples are estimated to have difficulty conceiving. To better understand infertility, it is helpful to know the natural pregnancy rate for the population. Let's say we have a group of 100 healthy young couples that start trying to conceive at the same time. After the first month, approximately 30 of the couples will be pregnant. Additional conceptions occur each month, but by 12 months, only 85 of 100 couples will have achieved a pregnancy. The 15 remaining couples are considered infertile, and investigations are generally started to see if anything can be done to speed up conception. The natural pregnancy rate decreases with increasing age of the female partner. For pregnancy to occur, 4 things are required: sperm from the male, an egg from the female, open fallopian tubes, and properly timed intercourse. Many people wrongly assume that male infertility is rare. However, it contributes to 50% of all infertility cases. Men have continuous sperm production, and an optimal environment within the testes is necessary to produce healthy sperm. Fevers and high heat exposure can impair sperm quality in the months following exposure, and poor sperm quality may decrease the chance of conception. Smoking cigarettes, certain medications, chronic medical conditions, and anatomical abnormalities can contribute to male infertility. Women undergo a cycle of egg maturation and release. The length of each cycle is determined by counting the number of days from the start of one menstrual period to the start of the next menstrual period. A cycle length of 24 to 35 days is considered normal and is indicative of ovulation. Ovulation is the release of a mature egg from the ovary, and it typically occurs about 14 days before the onset of menstruation. While some women experience spotting, abdominal pain, or breast tenderness as a result of ovulation, most are not able to accurately predict when they ovulate. A woman can calculate the approximate time of ovulation by subtracting from her usual cycle length. For example, if a woman has a 30-day cycle, 30 minus 14 indicates that ovulation occurred around day 16 of that cycle. If a woman is not ovulating regularly, she will have unpredictable periods. An important part of infertility management is to identify these women and to recommend lifestyle changes, such as achieving an ideal body weight, and to sometimes provide medications to help stimulate consistent ovulation. A female has all the eggs she will ever have at the time she is born. The number and health of her eggs diminishes over time. Menopause, when periods stop at around age 50, indicates that all the eggs are gone. Many women assume that they will continue to be fertile until menopause. However, the health of the remaining eggs deteriorates to the point where pregnancy is difficult to achieve as much as a decade before menopause. By the age of 35, the decline in egg quality results in longer times required to conceive and higher rates of miscarriage. The fallopian tubes connect the ovaries to the uterus. Tubal disease is when one or both of the tubes become blocked, preventing passage of the egg. Tubal blockage results from local inflammation caused by things like previous rupture of the appendix, previous pelvic surgery, endometriosis, or sexually transmitted infections. Sexually transmitted infections, such as chlamydia and gonorrhea, if left untreated for any length of time, can cause tubal blockage. Not all STIs lead to tubal disease. Human papillomavirus, or HPV, which causes genital warts, is often wrongly assumed to be a cause. A simple X-ray procedure called a hysterosalpingogram can be used to determine whether the tubes are open. and a surgical procedure called a laparoscopy can be used to evaluate and sometimes treat other causes of tubal blockage. It is important that the sperm and the egg meet at the correct time in a woman's cycle. One common misconception is that intercourse should occur after ovulation. Many women misinterpret the slight increase in body temperature following ovulation as their most fertile time. Actually, the chances of conceiving drop significantly after ovulation. The best time for intercourse is during the 6 days leading up to and ending on the day of ovulation. Commercial ovulation predictor kits detect hormones in the urine a full day before ovulation. If intercourse is timed to coincide with a positive ovulation test, it has been shown to increase the chances of conceiving. See if you can pick out other myths related to intercourse and fertility. If a woman lies down for 30 minutes after intercourse, her chance of pregnancy is increased. This is a myth. Position during or after intercourse has no influence on pregnancy rates. Timing and certain positions can increase my chances of having either a boy or a girl. This is a myth. The sex of the baby is determined by the sperm that fertilizes the egg, and with millions of sperm, it is impossible to make accurate predictions. Urination after intercourse decreases my chances of conceiving. This is a myth. It has no effect on conception. However, urination after intercourse may prevent urinary tract infections in susceptible women. Abstaining from intercourse for a week will increase sperm quality and improve our chances of conceiving. Another myth: sperm quality, including motility and morphology, does not increase by abstaining for long periods of time. Studies suggest that having sexual intercourse daily or on alternate days is best for conception. Using lubricants during intercourse may decrease our chances of conceiving. This is a fact. Some lubricants have spermicidal agents in them that destroy sperm. Talk to your doctor about lubricants that do not contain spermicidal agents, and use these while trying to conceive. Female orgasm leads to ovulation. This is a myth. Remember, ovulation is based on a cycle. Risk factors are qualities that increase the chance of developing a certain condition. An individual with risk factors for infertility is more likely to have difficulty conceiving. Age 35 years or older is a risk factor for infertility in women, whereas aging in men results in a more gradual decline in fertility. A history of sexual transmitted infections can put women at risk of infertility due to pelvic inflammatory disease, which was discussed earlier as a cause of tubal blockage. Infertility is common in women who are overweight or underweight because both can prevent ovulation. Women who smoke have higher infertility rates and experience more miscarriages. Research has also shown that smoking impairs sperm quality in men. The effects of alcohol on fertility are not well understood. However, experts suggest that women avoid having more than 2 alcoholic drinks a day because the alcohol may contribute to infertility. While it is true that certain lifestyle factors can decrease fertility, it is wrong to assume that just because you are healthy and have no risk factors, that you will have no problem getting pregnant. Pelvic and genital surgeries, cancer treatments such as radiation or chemotherapy, certain inherited disorders, and abnormal anatomy can all impair male and female fertility. There are also medical conditions that can increase the risk of infertility. Medical conditions in men can lead to infertility by interfering with sperm or semen production, sperm transport, or sexual function. In women, polycystic ovary syndrome, or PCOS, and endometriosis are common causes of infertility. PCOS is a condition that is often associated with obesity, increasing facial and body hair, and irregular periods. Endometriosis occurs when the lining of the uterus that is normally shed through the cervix and vagina during menstruation escapes backwards through the tubes and into the abdominal cavity, implanting on other organs such as the ovaries or the tubes. Can you spot the infertility risk factor myths? Prenatal vitamins can treat infertility in women. This is a myth. Prenatal vitamins do not treat infertility. It is, however, a great idea to take them while trying to conceive because they decrease the risk of neural tube defects in the developing fetus. My mother had difficulty getting pregnant, so I'm likely to have problems too. There are certain inherited conditions that can lead to infertility. However, infertility is often an unpredictable event, so family members are not a good predictor of your own fertility. If a woman notices milk discharge from her breasts, this may identify a cause of infertility. This is a fact. Benign tumors of the pituitary gland can cause increased amounts of the hormone prolactin that can cause milk discharge, irregular menstrual periods, vision changes, and headaches. Previous use of an intrauterine device, or IUD, can cause scarring or damage to the uterus, leading to infertility. This is a myth. The only methods of birth control designed for permanent infertility are tubal ligation and vasectomy, and even these can sometimes be reversed. Other birth control methods have no effect on fertility once they are discontinued. The only exception to this is the birth control shot, Depo-Provera, which in some women can keep working after the last injection and delay pregnancy by several months. Many women also believe that the birth control pill saves eggs for future use because it stops ovulation. Unfortunately, this is not true, and fertility will continue to decline with age, regardless of pill use. There are many causes of infertility, and proper investigations are essential to ensure the best management option is chosen. Sometimes, reestablishing female fertility may only require simple lifestyle changes, such as quitting smoking or attaining a healthy body weight. It is also common not to find any underlying cause of infertility, and much of this is probably due to age-related changes. There are still treatment options available for these couples with unexplained infertility. It is wrong to assume that treatment will always lead to a pregnancy. No treatment is close to 100% effective, and it is impossible to stop or delay the biological clock that leads to permanent infertility. Two common infertility management options include intrauterine insemination, or IUI, and in vitro fertilization, or IVF. IUI programs place washed motile sperm directly in the uterus prior to egg release, optimizing the chances of fertilization. The sperm can be from a male partner or a donor sperm bank. The woman must be monitored closely to correctly time the insemination, and many women take medications to stimulate the ovaries to produce 2 or 3 eggs at a time. IUI is a common management option that is suitable for many different causes of infertility. However, in order to be successful, the woman must have open fallopian tubes. For this reason, all women should have an X-ray test done prior to the start of IUI programs. In vitro fertilization is the treatment of choice for couples with tubal blockage, age-related infertility, very low sperm motility, or when using donor eggs. IVF involves stimulating the ovaries to produce many eggs that are then removed from the body to be fertilized by sperm in a lab. A fertilized egg, or embryo, is then placed in the woman's uterus. IVF is the most effective treatment available for infertility. There has been a steady improvement in IVF success rates, and women under 35 years of age can typically expect a 40 to 50% chance of pregnancy after one treatment cycle. The effectiveness of IVF declines with age, and women in their early 40s typically have less than a 15% chance of conceiving during each cycle. Because the success rates of IVF decreases significantly with age, many clinics stop accepting women using their own eggs over age 43. Beyond that age, women who conceive through IVF have generally used an egg donated by a younger woman. IVF is not always a feasible option because it is not generally covered by the Canadian healthcare system. The cost of one cycle of IVF is typically around $10,000, and many couples spend substantially more before they are successful. Infertility is a common problem among Canadians that can lead to disappointment and relationship stress. A range of available options can assist those wanting to start a family, including infertility treatments, assisted reproduction with donor sperm or donor eggs, and adoption. It is important not to delay seeking an evaluation if you are having difficulties with conception, and to be aware of all your options. You should contact your physician with any questions or concerns about your fertility.